Okay. Good day po, Sir Tarel Abinaw. My name is Denise Ibarondo from BSN 4C Group 2, and today I will be doing the return demonstration for endotracheal suctioning and the
Suctioning.
tracheostomy care. Good day, Doctor. Good day po, Sir Darrell Abinal. My name is Denise Ibarondo. I'm your student from BSN 4C Group 2, and today I will be doing the return demonstration for endotracheal suctioning and tracheostomy site care. So, first, the objectives of this procedure is number one, to provide airway patency by removing mucus and as well as any encrusted secretions in the tubings and the airway of the client itself. Also, to prevent any infection and further complications, and to provide patient comfort, safety, and care. So, first of all, before everything, we have to verify the doctor's order and assess the client's chart. And after that, we should always reassess first the client before any procedure. So we have to take note of the respiratory status of the client, which includes the ease of breathing, if there's any signs of respiratory distress, such as use of accessory muscles and nasal flaring, etc. Assess the respiratory rate, rhythm, and depth. Shallow breathing may indicate hypoventilation or presence of pain. Deep breathing may indicate hypoxemia or any complications. And also, we have to assess the client's lung sounds, if there's any presence for crackles, wheezes, or rhonchi, and also the O2 saturation of the client and the pulse rate, since tachycardia is often a response of the body towards low oxygen hypoxia, and bradycardia may indicate any severe hypoxemia and sometimes vagus nerve stimulation from the suctioning, etc. So after that, we have also to assess the site, the incision site, the tracheostomy site, if there's any sign of inflammation, infection, and if we take note of the character and odor of any discharge and secretions present. Also, if there's any drainage in the dressing, the tracheostomy dressing, and also take note if there's any signs of infection, inflammation, or any purulent discharge in the incision site. So after assessment, we will now proceed with gathering of the necessary equipment, which includes the disposable sterile tracheostomy cleaning kit, which includes the sterile containers to be used later, the nylon brush or pipe cleaners, as well as the gauze pad, sterile gauze pad, and also the sterile normal saline, sterile soaking solution, as well as the cotton twill ties and the tracheostomy dressings. And if the tracheostomy dressing is not available, we can utilize a 4x4-inch sterile gauze. So after the tracheostomy kit, we'll also have and prepare the suction catheter, sterile suction catheter kit, which includes the sterile suction catheter and the sterile container for the soaking solution. Also, we have to prepare sterile gloves and scissors, goggles and gowns, and the towel or drape to be used later, and the water disposable container or receptacle, depending on agency protocol. So after preparing the necessary equipment, we will now move on with introducing ourselves to the client. So if the client is conscious, we may now proceed with the um, introduction. So good morning po, sir. My name is Denise Ibarondo. I will be your student nurse po for today. From CSPC po ako. And may I know po your, now we verify the client's identity. So may I know po your name po, sir?
Paulo.
Surname po?
Bolivia.
Okay po. What's your birthday po?
May 28.
Okay po. So we use two identifiers, and then after verifying the client's identity, we now explain the procedure. So sir, ang gagawin ko po ngayon is suctioning and yung tracheostomy care po para naiwasan po natin yung komplikasyon and para maging mas epektibo po yung paghinga niyo po, sir. Okay lang po? Okay, so after that, we now provide client privacy, confidentiality, observe proper hand hygiene according to agency protocol, and as well as any infection control procedures. So after that, we will now prepare the client. So We position the client to semi-Fowler or Fowler's position unless contraindicated, such as presence of any spinal cord or hemodynamic instabilities, etc. So since it's not, in this case, it's not contraindicated, so our patient is already positioned in the supine. So after that, sorry, we now put our our towel or drape towards the client's chest and only expose the necessary area. After putting the towel or drape, now we will be donning our sterile gloves. Making sure that we establish our sterile field.
Mm.
Now that I have done my sterile gloves, now I'll prepare and open the other sterile kits. So I will be opening the tracheostomy kit and the suction catheter kit. And now I will be preparing solutions. So I will be pouring the normal saline towards 3 different containers, which will be utilized for the cleaning of the inner cannula, cleaning of the dressing, the inner ID tracheostomy site, as well as for the suctioning. And then I will also be preparing soaking solution, put it in a separate container. Now that I have prepared the solutions and opened all necessary equipments to be needed, such as the tracheostomy dressings, the sterile applicators, and the suction catheter, now I will be removing the inner cannula of the client. So in removing the inner cannula, you have to make sure that it's secure by only securing the external cannula, holding it in the flange, and then only grasping the exterior part of the inner cannula. You take it out slowly and gently according to in line with its curvature. After taking it out, if the inner cannula is disposable, you discard it immediately. But if it's reusable, we now soak it in the soaking glue solution. Now that the inner cannula is now removed, you should assess the client if there's any indications for suctioning, and if there is, we will now resume with the suction, endotracheal suctioning of the client. So at this point, I will be doing the return demonstration for the endotracheal suctioning. So for endotracheal suctioning, we position first the client, which you have already did, in supine position to maximize lung expansion. And next is we put on the towel or drape at the client's chest, which we already did. And then we put on the gloves and the gown if necessary. So assuming that I have already did. Next is we will now prepare the pressure tubing, wall-mounted pressure tubing. So before everything else, we would prepare the machine. So adjust it to appropriate pressure. So for adults, we will be using 100 to 120 milliliter mercury. For children, we will use 95 to 110 milliliter mercury. And for infants, we'll use 50 to 95 mmHg. hg. So after placing and adjusting it to the appropriate pressure, it may vary according to agency protocol. We will now occlude the distal end of the pressure tube to verify if there is negative pressure and functionality of the machine. So once it's confirmed, set aside. Once it's confirmed, we will now we will now prepare the sterile solution, but we have already prepared it earlier for the suctioning. So after that, we will now put on a new set of sterile gloves, since this procedure is minimally invasive and requires observance of sterile technique. So assuming that I have already donned a new set of gloves, sterile gloves, now I will be using my non-dominant hand. I will be preparing the solution, and during using my dominant hand, I will be picking up the suction catheter, which we have already prepared earlier, and connect it towards the end of the suction tubing. After that, we will check the functionality of the suction catheter by allowing it, soaking it in the normal saline, and allow a bit of normal saline to be suctioned by controlling the pressure by placing a finger over the suction pressure control cord. So once the functionality has been assessed and it's functional, we will now reattach the oxygen delivery device towards the client and hyperoxygenate the client with around 30 seconds, 100% oxygen delivery. So after hyperoxygenating, and we have assessed the functionality of the suction tube, we will now lubricate the tube with the normal saline. So after hyperoxygenating the client, we now slowly but gently, along with the curvature of the, slowly but quickly rather, we insert the suction catheter tube, making sure that we only put it inside around 10 seconds and remove it. When we put it inside, we make sure that there's no pressure still, and then when we remove it in a rotating manner, we put on pressure intermittently. So again, quickly but gently, and then remove in a rotating manner with intermittent pressure. So after that, we reattach the oxygen delivery device, hyperoxygenate the patient once again between 30-second intervals, and during the interval in between passes, we cleanse the the catheter by suctioning a bit of normal saline again and rinsing it the end of the tube in the normal saline. So while cleansing and hyperoxygenating the client, we remove and repeat the procedure until needed. So you repeat the procedure, making sure it's less than 10 seconds every interval, every suction, and 30 seconds every interval. So once the secretions have been fully removed, and we repeated the procedure once needed. So after that, we coil the suction catheter in our dominant hand, and then pull over the glove, and then discard in the appropriate container according to agency protocol. And then or in the water resistant bin or receptacle, depending on agency protocol. So after that, we have properly the suction. We may now resume to what we have earlier with the cleaning of the inner cannula. So that, since cleaning of the inner cannula requires observance of the sterile technique as well, I will be donning a new set of gloves. Sterile gloves. After donning sterile gloves, now I'll be cleaning the inner cannula. So we remove the inner cannula after soaking it in the soaking solution, and then using the pipe nylon brush cut earlier, we clean inside the inner lumen of the cannula. And then after cleaning, make sure to assess the cleanliness by putting it in eye level in front of the light source. And then once clean, we rinse it in the sterile normal saline. This is a separate container from earlier. And then gently tap it in the inner edge of the sterile container. And if you want it to be thoroughly dried, you can use the pipe cleaners folded in half and clean and dry the inner lumen. So once it's dried, we can now reattach it to the client. So we reattach it by slowly and gently, the similar manner we took it out, to take it in along the line of its curvature, secure the outer cannula, holding the flange, and then put the inner cannula inside. So once the inner cannula is now reattached, we lock it by securing it, twisting it until it reaches clicking sound, and secure it in the flange of the inner cannula towards the flange of the outer cannula. So once the inner cannula is secured, we can now move on with the cleaning of the tracheostomy site. So first off, we remove the soil dressing, discard according to agency protocol, and then we don a new pair of sterile gloves. So assuming that I have donned a new set of sterile gloves, now we will resume with the cleaning of tracheostomy site. So I will be using the sterile applicators prepared earlier. Soak it in normal saline under a separate container of normal saline, and clean the tracheostomy site. Discard every each stroke. So repeat the procedure at the step until the tracheostomy incision site is fully clean, discarding every after stroke. And then After cleaning it with the sterile applicators, we will now use the sterile gauze, soak it again in normal saline, and clean as well the incision site. Discard every after use. According to agency protocol. And then, I will now be cleaning the flange, the outer flange. Similar manner, soaking with normal saline the sterile gauze. Discard according to agency protocol. Repeat procedure until necessary. And once everything is done, we will now dry the area, both the incision site and the flange, by using a dry sterile gauze. So once the site is fully dried, we can now remove the tracheostomy tie. And then we replace the tie with the tracheostomy tie we have prepped earlier. Carefully securing the outer cannula and the flange. Once we have carefully, gently replaced the tie, tie, we can now move on with changing the tracheostomy dressing of the tie. So there is already commercially prepared tracheostomy dressing in our tracheostomy cleaning kit earlier, so we utilize that. And then we put it towards the client with our other hand carefully securing the cannula in the flange, exterior flange. After carefully changing our tracheostomy dressing, we now discard all disposable and soiled materials and equipments. Discard according to agency protocol. Sterilize everything, reusable equipments and materials according also to agency protocol. Observe proper hand hygiene. We document everything, provide aftercare, and document the procedures done, all assessments with the client before, during, and after every procedure, and as well as the response of the client towards every procedure that we have done, as well as every patency and conditions of every reassessment of the patient all throughout. So that's it. Thank you po for watching. Yay!
Hindi pala napindot.